In ALL, the key points that have come up, I think, with the fact that we are going always more towards less chemotherapy-based strategies. We would all love to avoid chemotherapy. We've had other examples in hematology. I mean, chronic myeloid leukemia is a beautiful example of how things are completely changed since having learned the biology, and transplant has disappeared, for instance, and chemo practically too. It's all through tyrosine kinase inhibitors, which have changed completely the prognosis of the disease completely. But I mean, it's not only that. In acute promyelocytic leukemia, we can control many patients without systemic chemotherapy. So talking about an acute leukemia, these are major changes. ALL is going in that direction, guided again by Philadelphia positive ALL. So in many meetings we are discussing how can we improve that. Last night we had another meeting, it was a board meeting, discussing potential other compounds that could be added to tyrosine kinase inhibitors, monoclonal antibodies, to increase the percentage of patients who become molecularly negative. If you're molecularly negative, you can hope that the disease is eradicated and you're impacting on prognosis. And CAR-T have been discussed. I mean, CAR-T so far have been used in relapsed patients. Now CAR-T are going to be utilized with limited disease much earlier. So this again is a major change. So these are things. The final point I can tell you, the elderly. The median life expectancy is increasing worldwide, and ALL increases again in the elderly. How can you treat an elderly? Systemic chemo is difficult to give, transplant is impossible. Monoclonal antibodies could be utilized in the elderly. So we have many aspects of major developments.